Don't you know I'm no good for you? I've learned to lose you. Hello. Welcome to the Space Spa Medical Center. Would you like me to check you in? Sure. Your name? Ah, yep, I see it. It's right here. You are right on time. I love that. Okay, what I'm going to do is I'm going to check you in very briefly, and then we're going to take you back into the procedure room so that we can get all of your prep started. Is that okay with you? Yeah? Okay. All right, let me just put a few things in here. How are you doing today? Yeah? Are you feeling okay? Yeah. It's okay. It's okay to be a little bit anxious. As a matter of fact, that's pretty normal. If you weren't anxious, it would be a little strange. You know, it's your body's natural response to something that you've never done before. And so I'm just getting your waiver started here. And okay, I'm going to hand this to you. And I just want you to look over that and go ahead and give it a sign whenever you're ready. It's just a standard release form. Yeah, and let me know if you have any questions. Oh, okay, here. All right, that's great. Okay, that's done. Just go ahead and have a seat down on the table. Yeah, right there on the paper. You comfortable? I know sometimes it takes a little while to get comfortable. It's a little chilly in here. Okay. No, I will be doing the procedure for you. Oh, they didn't tell you when they called you? Yeah, so because it's a holiday week, the doctor went on vacation. And so I'm going to be the one that's going to be doing the procedure for you today. Don't worry, I've worked in this medical facility for over 25 years. So I know exactly what I'm doing. And whatever you don't know, you can just ask and find out, right? What's that? Oh, yeah, I'm kind of doing everything today. I know I checked you in, and now I'm going to be the one to do. What's that? Yeah, I have. I've worked here for 25 years. Oh, as the janitor. Yeah, I fix things. And today, I'm going to fix you. And it's okay, because you're not even that broken. Really, we just need to make a few adjustments to your brain system so that you're not as anxious. And I know, I get it. Yeah, it's kind of funny that we would, do something like this and have a substitute surgeon come in that could potentially create some more anxiety in you. Yeah. Well, it's 2020, so, it's kind of the way things are going. But I really don't want you to worry. I'm telling you, I've been here for 25 years. And I've seen these doctors do these procedures over and over again. And it really doesn't look that hard. Here, you do it too. That's so perfect. Boop. Okay, all right, so I'm going to put that down. Oh, I don't need this yet. Right now, we're just going to focus on your prep. So I'm just going to ask you a few more questions, and then we can get started. Yeah? Okay. Do you have any questions for me? Yeah. What did I have for breakfast? Oh, just, eggs and some toast. Yeah. What about you? Did you eat breakfast? Yeah? That sounds lovely. That really does. Okay. Any other questions? Okay. I'm going to open up my little cheat booklet here. And this has just all the information inside of it. Just in case I get, a little turned around while I'm working on your brain. I just want to show you what we're going to do today. Okay. So here. In these photos, you'll see different parts of your brain, and they're all labeled here. You'll see this part here. Yeah. Okay. But what I want you to focus on is this one right here. You see this view of the brain? You can look at it, you can see the two eyes. And these are almost like muscly arms coming around it. And this is the mouth, right? Just stay with me here. This is an angry looking brain. And the problem with your brain is it's an angry looking brain. And so the only thing that I need to do is fix your brain's expression. You see, because a happy brain is a happy brain. Yes, this is all coming back to me. Oh, look at these funny creatures. I've never even seen this before. This is great. I don't even know what's happening there. What's this person doing? Such funny illustrations. We're gonna get you prepped up. For your procedure. And I have some gloves here. Yes. Yeah, it always takes me this long to put gloves on. They're a little tricky. gloves, especially when your hands are just a little sweaty because you're nervous to do surgery, is you can't force them on. You kind of have to sneak up on them. Now what I'm going to do is I'm going to take your temperature. Okay, say ah. That's good. Perfect. I love that. Okay, we'll put this over here to sanitize. Right, okay. Now what I'm going to do is measurement of your face here and around the top of your head, okay? Nice. Wow. Has anybody ever told you that you have incredible facial proportions? Eyes. Your nose. And then from your mouth to your chin. That's incredible. Okay. Yeah, I know. It might seem a little odd that I'm using a tape measure like this instead of like a soft tape, but I'm going to be using some non-traditional tools because that's what I've worked with here for 25 years, and that's what I'm comfortable with. Okay. Wow. 36-inch head. That's beautiful. That's beautiful. This is all looking really good. What I'm going to do is I'm going to give you a little bit of medication, and this will help with your anxiety. It should help you to relax a little bit, okay? This is looking good. These are lovely pills, aren't they? Look at how beautiful these are. You see this? They're beautiful. Yeah. So, they're all vegan capsules. And inside the yellow serum is a happy liquid. I think they make it yellow because, sunshine and happiness is yellow. And then the little beads in there, yeah, those are the little guys that'll keep you from being anxious. Okay. All right. So I'm going to give these to you. Oh, you want me to? Okay. All right. Open up. Ah. There you go. And then you can just grab that little bit of water over there if you need it. Oh. I see you're a pro at swallowing pills. Okay. No water. Champ. Okay. How you feeling? Still good? Okay, great. Going to have you open up your mouth for me. Okay, great, thank you. Okay, now in a moment, you should start feeling the anxiety medication setting in, and you'll probably start feeling a little sleepy, and that's quite all right. If you feel sleepy and you need to close your eyes, that's totally fine. Now, this procedure isn't going to totally knock you out. You're not going to be completely unconscious. So you're going to be aware of everything that I do. So you'll know that you're safe. And you can also communicate if you feel any discomfort, or if there's anything that I can do for you, if there's anything that you need. Yeah? Okay. So, I didn't explain this before. I want to explain this now. The other doctor was actually going to do a pretty invasive procedure on you, where the old method of brain surgery was to open up a part of your skull and insert tools and instruments into your brain. And what I've been developing in my janitorial lab in the basement is an experimental new age therapy, let's say. But really, it's a lot less invasive, and I believe that your procedure will be much more effective in this manner, and you'll also heal a lot quicker because we're not entering your brain. What we're going to do is we're going to use sound therapy, and we're going to coax your brain out of your head. I know it sounds a little weird. It sounds painful, but I can assure you that it's not. I've had at least a few test subjects join me in my basement janitorial lab, and we've had really, really great results with it. And so I'm very happy to be doing it now for the first time as your substitute brain surgeon. It really is exciting. We're making history today. Okay. All right. As the medication that I gave you starts to sink in, you will become a little more sensitive to light. So I'm going to have you put these on. How do you like those? Yeah? Okay. Now, what we're going to do, yes, is we're going to just trim up the hair around the sides of your ears. It's just a little long, and just so that there's no interference when your brain is coaxed out of your skull, I'm going to do it very slowly so that I only cut the parts that we need to. That looks nice. This is actually a good style for you. You mind if I do a little bang trim? I think it'll look nice. I love that for you. That looks really nice. Okay. I'm going to lubricate the outsides of your ears. Looks great.